Welcome. My name is Dr. Dreams, and I'll be your dentist today. You can have a seat right there. Alright, and I see today on the computer it says that you're booked in for an analysis and a standard cleaning. Is that right? Good. Alright. Before we begin, I'm just going to ask you a few questions. Now, I'm going to tell you the temptation is to tell untruths, but your teeth don't lie, so I'm going to see it anyways. So, if you'll just tell me the truth, please. Thank you so much. Alright. So, how often do you brush your teeth? You brush your teeth, right? Okay, brush your teeth. Alright. And do you floss at all? Don't tell anyone, but I don't floss either. It's boring. Okay, no flossing. Are you experiencing any pain, toothache at the moment? Toothache first. Good. And then anything in your gums at all? Good. Alright. Have you experienced any abscesses? Have you experienced any abscesses in the past? Anything that needed to be treated with antibiotics? Are you currently on antibiotics? Good. Okay. Have you had any fillings? Alright. How many? Good. Okay. And any other dental work, root canal, bridge, anything like that? Pulled teeth? Your teeth are from other people. Cool. Impressive. Alright. Do you know if you grind your teeth at night when you sleep? It's called bruxism. Teeth grinding. Like, your teeth can get flattened from it. People often wake up with jaw pain, or headaches, like a lot of tension causing. Sometimes, okay. And do you snore at all? Do you know? No. Good. Alright. And have you heard of TMJ before? Yeah, it stands for temporomandibular joint disorder. And what it means is okay, and okay, good. Is there anything else that you'd like me to know? Alright. Okay, well that's fabulous. We have enough information. Just take a seat there, please. I'm going to come in and put this around you so you don't slobber all over yourself. Okay, no spittle anyway. Alright. And if you'll just lean your head forward, please. Okay, good. There we go. Good. Okay. I'm just going to begin by taking a look inside and see what we're working with. Alright. So, just going to peek in. So, if you can just open and as wide as you can, that is comfortable, that you can hold in that same position. Alright, okay, good. Alright. And have you lost any teeth through any injuries or anything like that? No? Okay. Yeah, people often, it might be from ice hockey, field hockey. People tend to lose their teeth, rugby, those kind of more intense games. Okay, I see some things there that I would just like to examine. again, just open wide for me. Okay. Okay, tell me if anything feels weird or sore, anything like that, okay? Good. Alright. I'm just gonna pull your mouth open there a little bit. Does that one hurt a little? Alright, a little bit of a funny feeling over there. Let me just mark that. Alright. Okay. And I'm going to look at the top now. So, alright. Good. So, that is looking fantastic. Alright. I don't see any signs of severe decay or anything like that, so that's good. Even though you don't floss your teeth. Alright, I'm going to come in here. Good. Alright, there doesn't seem to be an excessive amount of build-up either, so when was the last time you were at the dentist? Okay, a year ago. That's not too bad. Okay, that is fantastic. So what I need to do now is a digital analysis. I'm going to put this device in your mouth, right? And it basically takes images of your teeth on the inside, okay? So it doesn't hurt. There's nothing that you need to do other than sit with your mouth open for me. Alright, and then those images are going to go directly to my computer and we'll be able to look at your teeth in even more detail. Good, alright. Good. Good. Okay. Okay, that seems to be all of the bottom teeth, and I'm going to come in and do the soft teeth. Alright, same thing. Alright. Good. Okay, and coming on this side. Good. Alright, just want to get a little bit more detail on the one that was giving you some extra, a little bit of problems, that one we found at the back there. Alright, so just hold still. Good. Alright. So, everything is pretty much as I thought. I do see one or two kind of more grey areas, but don't worry, we're going to go in and tackle those. There's nothing that needs any major root canal or the scary things like that. I personally have fear of the dentist, so sometimes I look in the mirror and I'm like, oh, but that's something else. Alright, so I just wanted to come in and check your gum health. Where is my little thingy? Okay, so I think it was that one that I was. Oh, there it is. It's the pokey one. So what happens is I'm going to use this. It's a bit sharp, so it's going to be. Yeah, you're going to feel it. But what I do, I can't show you one myself, is I'm going to just be fiddling around, and this pokes at your gums to see their integrity. So essentially to see how much red stuff comes out of them, how healthy they are, how quick they are too. Alright, so yeah, if you'll just sit with your mouth open, please. Alright, and I'm going to come in. Alright. Okay, and this is 2, 2, 3. 3, 2, 3. Okay. 3, 5, 3. 2, 2, 4. Alright, and open wide, please. 3, 3, 3. 3, 2, 3. 1, 1, 3. Okay, this side. 2, 2, 3. 2, 2, 2. 4, 3, 2. Okay. Do you need a moment? Good. I just need to do the top part now. Alright. Okay, and I'm going to be coming in and going this direction first. Okay. 2, 2, 1. 1, 1, 1. 1, 4, 3. 2, 1, 3. Alright, and this side. 3, 3, 3. 3, 2, 2. 1, 1, 2. And 4, 2, 1. Good. Alright. So overall, it looks like your gums are pretty healthy. I'm going to recommend a mouthwash. It is a medicated mouthwash. You can just swish that around your mouth 2-3 times a week, just to help your gums get a little healthier. Okay, and I'm now going to come in and see if there is any debris and things that I need to scrape off to get those pearly whites looking pearlier and whiter. This one looks like it's for putty. I don't think that's right. Alright. Okay, so I'm going to come in just with the light again and do a little bit of scraping and scooping. Okay. Okay, so good. Alright. Alright. Okay. There's a little stubborn guy over there. Alright, and can you make a big smile for me, please? Good, thank you. Alright, good. Okay, bring this bad boy in. Alright, and this side. Do you need a little break? Good, you're strong. Okay, good. Alright, that is fantastic. just need to take a mold of your teeth, if that's alright. Have a little bit of a spray here. I'm pretty sure that this is what the spray is for. Alright. It smells like vanilla, right? This is also, it's for this, and it's also for numbing. Would you like some? The vanilla scent is quite overpowering. Alright, so all good. Okay, I'm going to put this in your mouth. Okay, try to keep your bite as close to normal as possible. Alright, and then bite down and go. Okay, alright, so open wide and bite down. Yeah, like that. Good, alright, that's fantastic. And the next one, alright, we're gonna do the bottom. Okay, open wide and bite down hard. Good, alright, that is fabulous. Okay, I feel like we need to do some just manual flossing for you. Yeah, I know it can be quite tiresome, and but these are pretty useful. They are handy. They have this thing for flossing and this thing for whatever it's for. Alright, good. Okay, so open wide, please. Thank you. Good. Good. That's fantastic. Alright, and the upper teeth. Yep, you're doing so well. Alright, go ahead and give me a big smile. Good, okay. Good, I'm just going to go in there again. Okay, I'm just going to pull your mouth aside and look. Alright, on this side. Okay. Alright, that's great. Just a little more poking around and then we are good to go. Alright, so I'm going to come in with this little doohickey. That's a very medical term, doohickey. Alright. Good, okay. Good. Alright. Looking fabulous. Now I have a little tongue scraper. Do you brush your teeth? Yeah, I sometimes forget, but you want to brush your teeth. Just get rid of all that, whatever that stuff is that's on your mouth. So I think this is how it goes. So if you'll just open wide, and I'm going to scrape. Alright. Good, alright. You okay? Take a deep breath. I'm gonna go in again. Alright. the last two things, I have these drops. They are normally for massaging your body, but when you put them on your teeth, it helps your teeth massage each other, which is a more natural way for them to brush, floss, be rid of any debris, dirt. Alright, so I'm going to just come in and alright, so you can just open wide. Good. Okay, and if you'll just swish that around in your mouth a little, like that. Good. Okay, you can spit right there. Okay. Now I want you to give me one more big smile, please. And if you lick your teeth, does everything feel normal? Oh, good. Alright. That's fantastic. Once you have paid up, you are welcome to book another appointment for a year from now, just another checkup. In the meantime, if anything does come up before that, teeth, pain, abscesses, like funny things like that, please let me know immediately. I'm always available, and I would be very happy to put you in so that we can deal with any emergencies or issues. Alright. Okay. Well, thank you. It's been very, very lovely working on your pearly whites.